Thank you, Eric, again for joining us today ahead of our Global Health Exhibition. We're so excited to have you join us here as an esteemed speaker. As you know, the theme of the conference this year is Invest in Health, which may mean so many things. I'd love to know from your point of view, what does invest in health mean?
I'm really, really excited and honored to be attending the exhibition this year. So thank you for the generous invitation. And I'm hoping that the insights and my experience is going to be useful for the various participants there. In terms of investing in health, I think one of the things that is really important when we talk about investing in health, it does have multiple dimensions. If we think of the ultimate investments in health, they have resulted in, frankly, increased life expectancy, increased quality of life for people, which are investing in our society and the better health outcomes for people and of themselves, which admittedly, from a governmental perspective, help provide people longer life, longer contributions to our overall tax base, longer working periods of time, and thereby more giving of experience of people to society as a whole. All of those are ways that investing in health, we're truly investing in the fabric of our overall society and our communities.
Mhm.
At the same time, we want to think about investments in health from an economic perspective, that by investing in strengthening our uses of data and some of these new technologies from areas like in artificial intelligence, it can create innovations that improve our understanding of science. That those innovations are things that have economic benefit for people and economic benefit for governments. So we can think about health as an economic driver in that way by funding the innovation economies that we want, by using these new tools and capabilities we have from artificial intelligence and from better using our health data that we have in massive quantities that are drastically underused. So those are two areas I would call out from investments in health. I suppose the third area, which in a way ties to the first, where by investing in health is investing in many ways in preventative care. How can we help people not develop new chronic disease in us, not develop new cancers? So instead of shifting our or having our current focus as we have in our health systems on acute care and emergency services, how do we shift our focus to investing in the future of health rather than the future of sickness? Because many parts of our health system are investing in treating sickness as opposed to keeping people healthy. And if we keep people healthy through preventative measures, through things like detecting diseases earlier, we'll keep them healthier and happier for longer, which then again contributes to our overall strength of our communities in and of itself. So those are some ideas for you.
Great. So moving on to our next question, it's really important for us to bring together voices from across the globe to offer a different perspective. I know you get invited to lots of conferences. What was it about Saudi's Global Health Exhibition that stood out to you and inspired you to travel around the world to take part in this event?
It has been my honor working at the OECD to be invited to speak in places far and wide around the world. And explicitly, the opportunities for the Global Health Exhibition, I think it's really interesting because there is a burgeoning expertise and innovation that is coming out of the Middle East. I see things like the first fully digitalized hospital as one innovation that's recently come out from Saudi Arabia that I am particularly interested in. So I am interested in joining the exhibition to learn about some of these innovations that are possible where there are opportunities to, and there's really drive and championship around using these new digital tools and capabilities to their greatest effect. And such that I can take those learnings from Saudi Arabia in terms of what is in the art of the possible to the set of OECD countries that I work with on a day-to-day basis. Again, I am hoping to provide some of my own expertise that may be helpful, but really for me, the exciting thing was the opportunity to learn and see where the leading edge of digitalization is at and dream about where it could possibly go.
Great. Along those lines, we are bringing so many different nationalities and specialities together for the show. What do you see as the importance of global collaboration in shaping the future of global health?
Well, I think collaboration is at the center of all of this. We want to be thinking about how to achieve universal health coverage, how we achieve better health outcomes for every person wherever they live in the world without any economic hardship or benefit associated with it. I think it requires a massive amount of international collaboration and cooperation. Frankly, from the perspective of working at the OECD, the C is cooperation. And importantly, I think one of the major challenges that we have in and around the digitalization of our health systems and the use of tools like AI is our inability to scale. We have done great work at investing in technologies, but what we haven't done a good job of is scaling those technologies, either within countries or importantly across countries. And a big part of the ability to scale our innovations and the benefits that we're creating through our leading algorithms and our leading scientific research into health and the use of digital tools is that ability to scale. And that scaling requires cooperation and compatibility across borders. And so that's where international collaboration is not just about solving common problems together, which is absolutely essential. It is also actively learning from each other that I have a solution to a problem that somebody else has, and thereby we accelerate the resolution of those challenges. But it's also lowering the barriers to cooperation, simplifying the ability to design our solutions in a way such that they are compatible across borders, such that we can then scale up our innovations that we can wherever they're most beneficial and most needed around the world.
Amazing. With that, I understand your leading work at OECD that's looking at how countries can use digital health tools and AI more responsibly, especially through initiatives like the Health Data Governance Recommendation and OECD's expert group. Could you tell us a little bit more about these efforts and how they're helping governments strike the right balance between innovation, public trust, and meaningful impact?
Well, that's very, very important. So at the OECD, back in 2016, OECD member countries had agreed on a recommendation around health data governance. This is really important and has only become more important in the last 2, 3 years since the rise or the awareness of the potential power of artificial intelligence in our systems. Because artificial intelligence without data is like taps without water. They look really fancy, but you don't get a lot out of them. So we now are really realizing we are deep within this digital economy, and that digital economy is powered by effective use of data. The challenge that we have in many parts of the world is that we drastically underutilize our data. Estimates are that something like 30% of the world's data assets are in health, and yet health uses less than 5% of its assets for decision-making purposes. So if you multiply that through, we are not using more than 90% of our data, of our health data assets for decision making, which means we're not using more than a quarter of the world's data assets for decision making and beneficial purposes. That seems like a tremendous waste. And so with the work we do at the OECD, it's really championing the idea of how do we get more value out of the use of our data, use out of our digital tools, while ensuring that the controls around privacy and security are in place. So it's finding that and between use and control at the same time. And with overall, my perspective is what we do is we work with countries to work out from a policy structure. How do you find the ways to move fast? Because especially in the digital age, especially with the inclusion of artificial intelligence, there is great demand to move faster than we ever have before, while we are at the same time, because we're in health, doing no harm. And so we need to find a way of achieving those two things at the same time. How do we move fast while we are doing no harm? And a large part of that is designing the policy structures that achieve those two things simultaneously, achieving benefits for individuals while achieving benefits for communities. And so we need to think about meaningful ways of doing that. And so what we do is we work around the policy structures, we work with leaders in order to work out how countries are effectively achieving that and working closely with the public, with policymakers, providers, clinicians, and the private sector, because everyone needs to work together in order to achieve both this objective of moving fast while we are doing no harm.
Absolutely. Lastly, can you tell us a little bit more about what people can expect from your session at Global Health Exhibition?
I think you probably already got a taste of that through my conversation so far. I think what I'm hoping people get out of the session is a bit of inspiration. Some of the ideas that we have around the OECD, such as moving fast and doing no harm, but also bringing in some of the economic realities of digitalization. What are the expectations around the productivity gains? What are the cost benefits associated with going digital in and of itself? And it's also thinking of really hard problems and finding ways of framing those hard problems in ways that are understandable, digestible, and achievable, because we need to start thinking about what practical actions we need to be taking now in order to achieve the value of this new age that we're in. And so that we are spending less time talking about high level principles and more talking about detailed, concrete actions that we can take in order to achieve the outcomes that we want together for the betterment of individuals, communities, and countries around the world.
Thank you so much for joining us today, Eric. It was very lovely speaking with you, and we look forward to seeing you at Global Health Exhibition.
It is absolutely my pleasure. I'm very much looking forward to the events, Maya. Thank you very much.
Thank you.